Okay, let's go on to a question. An HIV-positive patient presents with an atypical pneumonia and was treated appropriately with sulfamethoxazole trimethoprim. Which of the following organisms can be reasonably treated with this regimen in the HIV patient? Is it A, pneumocystis? Is it B, toxoplasmosis? Is it C, Mycobacterium tuberculae? Is it D, A and B, which is both pneumocystis and toxoplasmosis? I've highlighted both of them there for you. Or is it A and C, which is pneumocystis and Mycobacterium tuberculosis? Good, you chose D, which is A and B. So trimethoprim sulfamethoxazole is an effective treatment for pneumocystis carinii pneumonia, or PCP, as well as toxoplasmosis gondii. Both A and B are therefore correct, so therefore the answer is actually D. This drug combination acts against folic acid production. It is not effective against viruses or against tuberculosis, and it is rarely effective against fungal infections. Now, when you're doing an exam question like this, remember that most of the board exams have dropped the K-type exam question, but some boards still use K-type exam questions. It is still worthwhile for you to keep your skills answering this type of question, but I will tell you that you probably won't get this kind of K-type in the USMLE Step 1. Okay, let's go on to another question. Mr. Locutus recently had an implant. He developed an infection that is composed of multiple gram-positive cocci and gram-negative rods. He was started on ciprofloxacin and responded well. 3 weeks later, he returns. You are considering the same treatments. Which is not a mechanism of resistance with this medication? Is it A, point mutations in the gene coding for the 30S ribosomal subunit? Is it B, changes in porins or pores in the cell membrane? Is it C, point mutations in the DNA gyrase enzyme? And is it D, enhanced ejection of the drug through new efflux mechanisms developed by organisms like Staph aureus? You chose A, point mutations in the gene coding for the 30S ribosomal subunit. So Cipro is an excellent broad-spectrum antibiotic. It works well against a whole host of bacteria, as well as some anaerobes, both gram-positive, gram-negative, and anaerobes. These are the types of infections we see in prosthetic infections, tunnel infections, and dirty procedures, for example, an emergency treatment of a motor vehicle accident. Resistance develops through the following mechanisms. Number 1, decreased intracellular accumulation due to changes in the porins. Number 2, efflux mechanisms in Mycobacterium tuberculosis, Staph aureus, and Strep pneumo. And number 3, changes in sensitivity of target enzymes like the DNA gyrase, also called topoisomerase, via point mutations. Now, Cipro does not act through the 30S ribosomal subunit. The correct choice, therefore, is A, because that's the incorrect answer.